Welcome to your new obsession, where every episode is packed with the tools and science to help you become the best version of yourself. Whether you're a biohacking newbie or a seasoned pro, you're in the right place. Let's get started.
Hello and welcome back to the Biohacking Trainer Podcast. I'm Luke Czaplewski, your host. Today we're going to be deep diving into the fascinating world of red light therapy and exploring the many benefits it offers for your health and wellness. Let's get right into it, shall we? So let's start with what exactly is red light therapy. Simply put, red light therapy is the use of, or also known as photobiomodulation, but it's the use of very specific wavelengths of red and near infrared light that stimulates your body's natural healing process. So it's the use of about 660 nanometers of light for red or deep red, as well as 800 to 880 nanometers of near infrared light. So the way this works is essentially that light penetrates your skin and is absorbed by your mitochondria. Now, in regards to penetrating through your skin, that means like if I'm wearing what I have on today, I would have to make sure the shirt is off and skin is exposed. Otherwise, the light is not strong enough to penetrate through clothing and through the skin to get down to the mitochondria. Now, it's going to roll it back a little bit here. So let's say we're down to basically the areas we want to work on, and the skin is exposed. The red light and near infrared light is penetrating through the skin. It's going to get down to the cell, and it's going to get down to the mitochondria, which is basically the powerhouse of your cells. So when it gets into the mitochondria, your mitochondria have these little things that are called chromophores. Now, these chromophores are sensitive to light emission. So the near infrared light is going to stimulate the chromophores, which is then going to produce more ATP production. So ATP essentially is just the energy currency of your cells. So when more ATP is being produced or synthesized, it's then just going to give more energy to all the cells and give them more energy to do what they're intended to do. So some different benefits you can see from a physiological standpoint from the use of red light therapy and, say, near infrared light. You're going to see a lot of different things. Improved recovery times. A lot of athletes will utilize red light therapy services to recover quicker after a hard workout or a series of games from a tournament. From clinical setting, you might say some PT clinic to help with recovery, but also wound care or wound healing. Now, you wouldn't say use it on like a active and open wound, but if somebody has a close-up wound that has sutures in it, you may want to use red light therapy for that. Or if you're trying to heal a scar a little quicker, you would utilize red light therapy for that purpose as well, to stimulate the skin cell to heal and recover a little quicker. Other things you can see red light therapy being utilized for is improvement of visual acuity. It can also be utilized for stimulating hair growth. Now, if somebody's bald, it's not going to fix that, but if you're starting to thin a little bit, you can utilize red light therapy to stimulate those hair follicles to grow a little bit thicker as well. So those are just some different physiological benefits of red light therapy that somebody can experience. Typically, when you're utilizing red light therapy, you only want to do about like a 20-minute session, because with the use of photobiomodulation, it has a curve shape to it. So less than 20 minutes, you're not going to get too much of an impact. Up to that 20 minutes, that's where you're going to see the peak in regards to beneficial impact. Anything after 20 minutes, you kind of get a law of diminishing returns where, you're not going to see extra improvement. It's basically going to plateau, or you're going to basically go back and you're not going to have any benefit from too long of a red light therapy session. From a practical standpoint, again, 20 minutes typically. You can utilize this during a workout. At my facility, Ageless Fitness, we utilize red light therapy with halotherapy in tandem. And we utilize it in one of our booths that has a assault bike. So you can utilize the two services and get a workout in. And that red light therapy is just going to help with, say, muscle production, muscle activity, and then also that recovery process in the latter half when you finish your workout. When you combine the two, that's just going to give you enhanced, say, lung function, enhanced lung capacity, because halotherapy, in short, just think of that as the toothbrush for your respiratory tract. The salt's basically a natural absorbent, has antibacterial and anti-inflammatory properties. So it's basically just cleaning out the airways of any like mucus, any bacteria by killing off the bacterial cell wall of the bacterial cell and killing those off. So you basically say utilize that in tandem together to get enhanced athletic performance outcomes. You can utilize red light therapy as a recovery tool as well. After your workout, you can put yourself into a booth. In our case, we utilize Vitality booths. Some locations may just have a couple of panels, or if you have one at home, you can utilize that. If you tend to find you have an area that you're typically really sore, you have more aches and pains there, you want to have that red light panel aimed directly at that area so it can penetrate through the skin, enhance that mitochondrial activity and more cellular function and cellular health, and help you with recovery, alleviate any pain, any inflammation that joint might have. Let's say you're also working on the shoulder, you just want to make sure the shoulder's exposed and you want to hit that area too. Now, you can focus on the full 20 minutes on that one area. I usually recommend, if you're just looking at overall wellness, you kind of split it in half, like a 10 and 10. So 10 minutes working on the front half of your body, 10 minutes working on the back half. Now, if it's somewhere where you just have one large panel, like at home, you could do 10, flip it around 10. Some cases, if you're focused on different areas, like the lateral part of your shoulder, lateral part of your elbow, you could go 5 minutes to the lateral aspect of your body, 5 minutes to the frontal, 5 minutes to the other lateral, and then 5 minutes to the posterior aspect of your body. That way you get full 20 minutes working on every basically square inch of your body. In some cases too, from another therapeutic standpoint, red light therapy is also shown to be very beneficial for cognitive health, brain health. They have different technology now rather than just panels. I'm sure you've seen from an aesthetic standpoint, the masks that you can wear, those are always beneficial in enhancing collagen and elastin production to help keep that skin nice and strong and firm. From the cognitive aspect, there are now helmets and intranasal tubes that you would wear. And those are typically putting about 810 nanometers of light, or near infrared light. And with the nasal cavities, those are putting out a little bit more, about 1070 nanometers of light. So with that, I mean, essentially what you're looking at is reducing any of the inflammation surrounding the brain. You're also enhancing cell production and brain activity. So you can use that for more therapeutic cases, like a wellness clinic or a physical therapy clinic looking at alleviating symptoms for those that may have dementia or Alzheimer's. From a practical standpoint, red light therapy can be used both before, after, and even during a training session as well. Now, just to kind of wrap up the day, essentially red light therapy, think of that as a very powerful non-invasive tool that can enhance your health and vitality. Whether you're recovering from an injury, looking to improve your skin, or seeking better muscle recovery, red light therapy truly does offer some promising benefits. Now, as always, it is best to consult with your healthcare provider, especially if you're hesitant about the use of red light therapy. Definitely check in with your healthcare provider to make sure it's something that would fit your needs. Make sure to follow us and like and subscribe on YouTube and Apple Podcasts. As always, stay healthy, stay curious, and we'll see you next time on Biohacking Trainer. Have a good one.